I'm Dr. Anderson with North Texas Plastic Surgery, and today we're going to talk about a topic I love, and that is facelift surgery. So I'm going to go through 5 things that either I think are important for you to know before we talk in your consultation, or maybe things you're just not aware of that I think are worth learning when it comes to facelift surgery. So one of the first ones is age range. So if you're already thinking about it, this question may not be for you, but if you're like just starting to form an idea, it may be, am I too young for a facelift? Am I too old for a facelift? So technically there's no age range, but it's very common for folks, even in their 40s, and it might even be early 40s, to start seeing things that they don't like, and maybe they've been going to their esthetician and their injector for years, and some of the stuff that was working in the past, the Botox and the fillers, aren't quite getting them the mileage they used to, and so now they're kind of thinking, I might need to do something a little bit more invasive to get the results that I was seeing maybe 5, 10 years ago, whatever it may be. So honestly, people in their 40s end up being great candidates because the ability to give them a rejuvenated look that's not overdone can honestly be a little bit easier. That being said, there's also no real maximum of age range for facelift either. I've had patients well into their mid 70s that are just like, you know what, it's been this way for a while, but I'm ready. I'm like in a new phase of life and I just want a more refreshed look. So no real specific minimum or maximum, so long as you're healthy and you have realistic expectations. The age range can be slightly wider than I think people think it is. Next thing about facelifts that's super important is it's exceptionally common to have multiple rejuvenated procedures to the face at the same time. So it may be that you come in and say, I'd like a facelift, but you have other things in the face that are contributing to an aged look that if they are addressed will overall give you a much more balanced and youthful result than if you do a facelift by itself. So very common things that will be done at the same time are upper lid lift, lower lid lift, possibly if the upper lip has become lengthened from filler dragging it down, or just age, a lip lift. Those are very common procedures to do with it that just increase the beauty of the result. Next thing that I will recommend with almost every facelift is some amount of fat grafting. So over time, faces tend to descend in certain planes, as well as lose volume in certain other areas. So adding volume back in the form of fat grafting helps restore that youthfulness that a lot of people are looking for, that if we just tighten alone really won't get us there. Another additional benefit of fat grafting is it can make the skin itself appear more youthful, which is just kind of a secondary benefit that is wonderful. Another aspect that's important to talk about, I won't get into like the nitty-gritty details of it because it's too advanced surgery talk, but is most folks now are doing what's called a deep plane facelift. I think a lot of folks fear when it comes to facelift surgery is that they will look like they obviously had something that just looks like science-y or a sci-fi character, and nobody wants that. They just want to look like themselves, but maybe themselves from 10 years ago, like the best representation they think of themselves. So now what we're doing is what's called a deep plane facelift that better lifts all of the tissues as opposed to just pulling on the skin, so that I can give you a much more natural result of that 10, maybe even hopefully 15 years ago, as opposed to just being pulled stark tight and looking like something that nobody wants to look like. If you liked this content and want some more in a slightly longer format, you can check out my recently revamped Facebook page at NTPS Dr. Anderson.